Welcome, everyone. As we have people joining the call, we are here for a webinar. This is just a reminder that we are in webinar function, so you will be muted, but we have enabled the Q&A feature. So if you would like to submit questions, we will be using that information to inform future conversations and sessions moving forward. And it looks like we still have some people logging in. So we're going to give just a couple of seconds here and let some people join us. And I want to welcome everyone. I'm honored on behalf of the California Collaborative for Educational Excellence, California Health and Human Services Agency, and the California Department of Public Health to welcome all of you today. We realize you have very busy schedules, and we really appreciate you taking the time to join us. We have a large number of representatives from our local school districts, county offices of education, and charter schools joining us today for the webinar, COVID-19 Updates in Public Schools, a conversation with state public health leaders. The intent of today's conversation with Dr. Galley and Dr. Pon is in response to the recent wave of counties moving into the most restrictive tier, with an interest in discussing the current science and appropriate response to the pandemic. Today is the first of what we hope to be continued conversation with educators and our education community as we continue to navigate the virus. We're looking forward to future conversations. And as I mentioned, we are in webinar mode, and we encourage you to go ahead and use the Q&A feature to submit questions. We will be using that to inform future conversations with all of you. I'm very honored to present and introduce our presenters. Dr. Galley is the Secretary of the California Health and Human Services Agency and leading the state's overall health response to the COVID-19 pandemic. He's also a pediatrician and parent of 4 school-age children, and we are fortunate to have him join us for the first part of the session today. He has a few press conferences to attend to, and so we really do appreciate his time. We also have Dr. Pon, our acting state public health officer at the California Department of Public Health, and she is also leading the state's response to the COVID-19 pandemic. And she's also a board certified pediatric infectious disease expert and parent of school-age children. So as we set the context for today, we're going to be covering three key areas. We're going to focus on the science. We're going to do a little bit deeper dive on the science. We're also going to talk about supporting educators and equity. And we're going to continue to come back to our desire and our interest to have an ongoing engagement with the education community and designing future sessions that will best suit your needs. And so we're going to be hitting these points throughout the presentation. We've got about 60 minutes or so. We've got a handful of questions for our experts to respond to, and they will be embedding kind of this content area throughout their responses to the questions. So the first part of the session, probably the first half hour or so, we're really going to focus on the science, and we're going to turn it over to Dr. Galley to kind of give us that context on what is the science before we get into our first question. So Dr. Galley, I'll turn it over to you. And you're on mute. There you go.
Sorry, hopefully you can hear me now.
Yes.
First, just want to thank the California Collaborative for Educational Excellence and Michelle and you and the whole team there on inviting us and hosting this. It's always a privilege to be with a number of groups across California, but to be with our educators and you as leaders of schools. It is no accident that I chose to be a pediatrician. I care deeply about the development of our young people. I'm sure as a father of 4, it's part of it, but another sort of part of both Erica, Dr. Pon and I's past is she was an attending physician when I was training at UCSF and taking care of a number of kids in San Francisco, and really seeing that connection between health and education, and really just you are heroes in so many ways, and it's a privilege to be with you, and I'm grateful for all that you do for each of the families and young people across the state. I want to start talking a bit about the science, but really trying to sort of connect on what we know about transmission. So COVID-19, coronavirus, it's a family of viruses that we know well in pediatrics. If you think about the common cold, it's made up mostly of between 6 and 12 pretty common viruses, depending the year. And there's 4 of those that are coronavirus. So in that family, we have what is the common cold virus in many, many ways. We also have more severe infections within coronavirus, SARS, MERS, another virus many years ago that was quite virulent, meaning that it caused pretty grave illness. It didn't spread as wide as some of the other coronaviruses because what it did was, many people who became infected died. So they didn't have the same level of opportunity to spread it, if you will. So we've been dealing with coronavirus for centuries. And so COVID-19, although it's part of a family of familiar viruses, it also has some very unique features that we keep often learning about. One of the features, which I think we learned very early on is one of the more treacherous features, is that it does create quite an intense inflammatory response. And that's why we've seen people who have pretty prolonged illnesses in intensive care units. You've heard the stories and the focus around ventilators, and that's in part because that intense immune response essentially creates difficulty with air exchange, oxygen, carbon dioxide exchange within your lungs that really does put people in pretty significant and grave situations. That said, we have learned so much over the last many months, and this is the reassuring part, that we have learned that through certain medications and the use of those at particular times, the use of ventilation and other respiratory supports at really strategic times. Early on, people were intubated very early. They were intubated in traditional ways, but our brilliant intensive care unit doctors and nurses across the nation over many months have learned different and more effective ways. And so today, one of the things I'm really proud about for California is our early action to not avoid infections entirely, but to push them out farther into the future, gave us an opportunity so those who did become sick could benefit from these wonderful advances in how we treat it. That said, we still know that there are complications with COVID, things like kidney disease, cardiovascular disease, a number of what we call coagulopathies, issues with how our blood clots, either too much or too little. These sort of issues are not uncommon with infectious diseases, but often infectious diseases have their own unique impact on the rest of the systems within our bodies. And we are learning more and more, figuring out how to treat these. And we've also made many advances in this regard. So we, versus where we were in February and March early on, when we knew almost nothing about how this would behave, we've learned so much, and those have been to our benefit in treating and taking care of individuals. There is a point I wanted to focus on about kids and COVID. You heard early on different stories. Kids don't get it. Kids can't pass it on. Kids don't get as sick. And then the other side of it is, well, no, that's not it at all. Kids will get it just the same. Kids will become just as sick. They're just as vulnerable. I mean, we have learned that there is a clear increasing, more worry as you get older with being infected. It isn't that kids don't get infected. It's not that kids can't be vectors or transmit COVID. It just happens a lot less frequently. And the reason why, in part, is because each of our cells in our body has a number of receptors, and viruses and other pathogens, as we call them, enter those cells by a variety of different mechanisms or receptors. And there's one particular receptor that people grasped onto early that kids don't have as many on their cell surfaces. And so COVID doesn't have as many front doors, if you will, to get into the cells of younger people, unlike what we know about older individuals. And frankly, some of our oldest, most vulnerable to COVID residents, where this receptor in particular is very prevalent or available. So that is the case, and that does lead to the fact that kids often don't either become as sick or in some ways get infected as often. But that does not mean that they aren't important parts of our story. We take it seriously. We know there's stories of kids who become quite sick. We're trying to understand what those unique characteristics are. And as we learn, we'll be sharing that with you. So what does that mean for transmission? I mean, it really means that all of the protective factors that we'll be talking about in a little bit are really important, not just for you as adults, but for kids as well and students of all ages. We know that the younger the child, usually we sort of break off kind of the lower end of middle school and below, where we know that this ACE2 receptor that I was talking about isn't as frequent or common on our cell surfaces. And in high school kids, you see it manifest a little more. And that's why we've learned that the younger the kid, often the less vulnerable they are, often the less likely there are as vectors. So I'm going to stop with that because I think it's an important part of what guides us, and maybe take, Michelle, a few questions on this issue.
Yeah, that actually leads right into our first question. That was a very helpful background, so thank you for that. Can you speak to the science in regards to the spread of the virus with the younger students and the importance of small cohorts? So maybe elaborate on just what you were just sharing with us, and focus more a little bit more on the cohort aspect of it.
So what we know, and so whatever level of risk you have as an individual or as a community, we know that there's a few important features that help us reduce that risk by increasing our protective factors. And you hear these all the time. I hope if you ever tune into the governor and you know, some of the updates I give, or your local public health leaders, Dr. Pon gives them all the time. We talk about these sort of basic things like masking, keeping your distance, keeping things small, keeping it outside. All of these things translate into actual behaviors or conditions. And this idea that a small cohort, a group of kids and adults, in the case of schools, that comes together and stays together. They don't mix, so it's not 5 kids Monday, another 5 the next day. What that does is it creates a bit of like germ familiarity. People are together in that small group. They've sort of, they're stable in how much and who they share those germs with. And often what we find is it also helps us control when any infectious disease happens, that it doesn't spread too far. One of our strategies, we've never had the strategy because it's an impossible one, and you'll hear this from Dr. Pon later, to have no infections. I mean, it's just not possible. But we can do many things like small cohorts to make sure that we limit the chance of infections coming into a cohort, and that we make sure if it does come into a specific cohort, it doesn't spread to others. So in many ways, it's really keeping things small, keeping things consistent, so that we don't have spread beyond those groups.
So continuing with our theme of science, we wanted to know if you could clarify a little bit more, what is the science that allows schools that have been open and are mitigating the virus with the appropriate safeguards and response to stay open in the purple tier? So this is actually a really popular question that we're getting from the field that we'd like you to respond to, please.
Yeah, I'm gonna start and then invite Dr. Pon, who, you know, we've together been thinking deeply about this, because we think it's a very important and frankly reasonable question. Why can't you open until you get to red, but you can stay open when you go back to purple? Partly it's what you said, Michelle. It is that the confidence in our understanding in some of these protective factors, protective behaviors, it works. We see it all the time. You know, in many settings, the use of face coverings and masks and Using a surgical mask, even from a face covering, can add a little additional protection. Making sure that we keep cohorts stable and small, preferentially trying to keep things distanced when possible, but cohort stability is important. That we can use things like testing to verify that we're moving forward in the right direction. So the level of support that we can provide a group of students and teachers and staff who are in the purple tier after getting familiar with the procedures and protocols in the red, that we have seen success in these areas. And being able to support the ongoing in-person education, if that's the will of the schools and the families and the staff, that it is possible in purple because of those protective factors, we feel with growing degree of confidence is possible. That said, it does hinge on us making sure that we implement and support and don't take our guard down with certain of the behaviors that we've talked about already and we'll hit on again in a moment. Dr. Pond, do you want to add to that?
Sure. I mean, I think a couple just things to add to that are that we also have seen both across the country and in other countries, schools that have opened with higher levels. Actually, our purple tier, we're proud of how well we've been doing in California, and as you know, we're concerned about the current surge, and which is why we were taking all the actions we are taking. But we have managed to have much lower levels here, and our levels that we consider even sort of what we're calling the purple tier or widespread tier are actually different or lower than many other parts of the country or the world. So I think there's that. And again, also we've seen some successful school reopenings without large outbreaks, with certain jurisdictions doing very few of the measures that we're recommending, all of these measures, again, the masks, the cohorting, the physical distancing. The other thing I would just add to the sort of public health science that is really interesting is that it's both the public health and this virus, it is true that many respiratory viruses, and specifically the flu, when we did, and the other background I have is one of my focus jobs, my first job in public health was to focus on pandemic flu planning. And flu definitely is, a virus also that is very common in kids, and typically kids don't get as sick, except those rare outcomes you occasionally hear about, but it does drive transmission in a pandemic. And this virus is not like that. It's been really surprising and interesting to us. And again, we've had more and more evidence about that moving forward. So I think the layer onto that is that a lot of the modeling and interventions that we planned with pandemic flu planning about closing schools was because we were so concerned that schools and kids were driving transmission in the whole community. And we're really not seeing that evidence with this virus. But again, more time will tell, and we learn more every week. But I think that's another important thing for people to understand. And I think, again, hearing some of the focused experiences, Marin County is one example. They've opened, I think, over, I forget their number. It's a small community, but over 82 schools. I think they have over 30,000 kids in school. They've had, a handful of cases. None have been associated with transmission in the schools. And they've not seen a dramatic increase in their community transmission. So, and there are other places, of course, around the country who are seeing similar things.
Michelle, I'll just add one last point that Erica triggers for me, and this is really a credit to Erica's team working with public health local leaders across the state, is really working hard to not just have these protective factors that are about things like masks and the distancing in cohorts, but also bringing to bear the full level of response on public health. So meaning having disease investigators, having contact tracing, having sort of how do you circle the wagon on a case so it doesn't become 2 or 3 or 4, that even if the transmission didn't happen in the school, which most of these cases do not, that we're able to really protect the cohort in a way. So I think that's another feature that California, not even at the state level, I wish we could take credit for it, but it's so much at the local level, how their work with schools historically has allowed that to happen.
Yeah, I mean, that's a great point. We've been learning from the field. Marin is a great example that has a very strong relationship with the county public health, and they've been working hand in hand and building out kind of the small cohorts, piloting, testing out their protocols, and tracing efforts. So we're looking always for more examples of LEAs that have those kinds of relationships, and so that was really helpful. Thank you for that. We're going to move on to kind of our next couple of questions where we're really going to get into more supporting our educators and equity. And in particular, what are effective prevention measures that LEAs can take? So we just started talking about that in terms of the masks, the basics, small cohorting, setting up your procedures and protocols, but anything else that you want to add to and clarify for our participants?
Erica, why don't you go ahead?
Sure, yeah. I think if I have any Alameda County colleagues on the phone, I worked closely when I was at the local level with our County Office of Education. And so I think, again, working closely together, I think making sure that each district and each school has sort of a COVID lead to really be thinking through and staying on top of the latest information that's coming from us at the state, from your local health department, seeing what's going on with the CDC, and developing those plans for those cases, because as mentioned, right, we can't get to zero infections, and the experiences we have seen across schools is that and even childcare for that matter, is that you might see the proportion of cases similar to what is happening in the community, but you can really, if you're prepared and you make sure you have a place, and we have very detailed guidance about this, you know, if you have a place for the staff or student to be, well, a staff you could just send home, or a student, you know, where they can be isolated from others, and then also being ready to think about who is in that cohort, who might have been exposed to that student, and being ready to then, you know, work with your local health department to quarantine those people, also get testing of any suspected cases or contacts. And then I think the other kind of secondary things that those first things that we all talked about, as far as, again, the most important preventive measures are, you know, working on the ventilation, you know, open windows, the masking, the distancing, the cohorts, and then other things that, you know, I think are kind of in the toolbox are screening. So, you know, we are learning again that as far as resources, those other things are the most important, but other things that you can layer on top of that are screening. So having parents, you know, do a symptom check. You know, for my kid now, we're kind of testifying on an app that we've checked her temperature. She has no symptoms before she goes. And then surveillance testing is a tool that some are using. So trying to do testing, especially staff, is the most important. Actually, one other key point, I think Dr. Galley started to mention this, but we want to emphasize too, a lot of the transmission that has happened at school has really been more staff to staff and adult to adult. And that's certainly, you know, what we've seen in some other workplaces is if people let their guard down in the break room, or, you know, taking their masks off to eat, but being too close to each other, or not doing that outdoors. So so that's the other reason we, and just for the other science-based reasons about kids versus adults, to do prioritizing testing for the staff.
So just one other thing, building upon what Dr. Pond just laid out. I want to emphasize, and she brought it up, the concept of break room. It's actually, what it's really meant to signify is the place where we often put our guard down in our normal daily lives, right? This happens in hospital settings a lot. We've actually seen transmission, not patient rooms or at the nurse's station, but it's actually in the break room when two friends and colleagues take off their masks to share lunch, and then one who's infected and asymptomatic infects the other. We've seen a number of outbreaks in quote school settings because educator leader is with their band students or their drama students, where they think maybe it's a little safer because they're more familiar. One of the messages that we've been pushing, especially going into the holidays, is don't take your guard down just because you're with your best friend or your cousin or your brother or sister. That's actually a time to be extra vigilant. And you can imagine how that translates into the school or workplace setting. So it's a piece of advice that we think is really, really important. And then another change, because, and you know, I really give Dr. Pond so much credit for constantly looking at the science and updating what we want to be doing. Early on we thought it was okay to say, hey, maybe the youngest kids, because it's hard to keep a mask on, it doesn't have to happen. But now we know that the protection of a mask is so critical that added benefit and creating a lower risk environment is important for all students. So really working with you as leaders to get that message across, part of our guidance now, to have even the youngest TKK. I have a first grader. He's actually one of the most compliant mask wearers in my entire family, which puts me to shame on occasion. But it's bad when he has to remind me to put on my mask on the way to the car. But yeah, it is true that we believe that they doing it really benefits all of us as well.
Great, thank you. Yes, we're hearing that as LEAs begin to implement safety protocols, they become more efficient, but with that efficiency, then you kind of let it up a little bit. And so we're trying to figure out ways to support LEAs and being vigilant and maintaining those stricter protocols when possible. So we're going to shift.
Just, Michelle,
yes.
one last thing, because I think we often talk about physical design of spaces and opportunities. I mean, one thing that they've done in some hospital settings is they've closed the break room. They said no more, right? They found a way to have people eat in other places, go outside. And I think these are challenges, but they're always worth considering if possible. They're not always possible, but you can modify only so much, but you can remove some risk if you take some other steps that with some planning are possible.
Great. We're also hearing examples from LEAs using every bit of square footage for instruction. So the break room becomes a space for students to study and do work as well. So that's a great example. Thank you. So our final question, we have a bit of time, so we can spend a little bit more on this one. If you could provide one clear message that you would like educators to know as they make further development plans for in-person instruction, what would it be?
Hey, Erica, maybe I can begin this one because I have to sign off in just a few minutes, if it's okay. But the clear message I would want to communicate to educators, and one that's sort of deeply felt by myself and our whole team, is we're here to be partners, right? I think this is a tremendous opportunity to deepen our partnership at a critical time, frankly, in the history of the world, and how we can support you to do whatever you do as low risk and safely as possible is important. And we're constantly hoping to update our guidance and with the latest and greatest, not to be more flexible, but to be more clearly connected to that science. To figure out what tools you need, that if there is that one clear message, it's one of partnership and working together and creating an environment where all of the questions get answered, so that when you do make a change in what you're doing in the district or in an individual school or classroom, it's one done with some confidence and support from public health at the moment. And that this concept of safety first is one we take very seriously across the state. We've taken a lot of actions to get there statewide, and in addition with our education partners.
Great. So I would just add, actually, no, I'll just back up for a moment too, because I want to also just echo and say how much I value educators and education. And, as Mark said, but I, of course, completely feel the same. I just have so much appreciation for the educators that have, that are taking care of, our community and bringing up our children and nurturing them and educating them, and certainly for my own children. And I really admire and appreciate how much educators go through. So that's just a background thing. And I think as far as other clear messages, I think that we in California, I started to mention this, but we are so proud of how well we've done so far. And I think we have the resources and we want to provide the supports as far as the state health department and the state administration. School and education are our highest priority, and we have the tools we want to be able to provide that support to schools. And again, we're doing everything we can to, support safety and being evidence and science-based, as Dr. Galley mentioned, and just balancing sort of all the different needs of our schools and our society. So again, we've got these great tools, and we want to work with you together in partnership to figure out how to best make that work.
So we've been hearing, obviously through the Q&A, and we have quite a few questions, but some of the questions relate to what we've been talking about. And so, the state supporting as best we can, LEAs bringing students back. And in particular, when we talk about small cohorts, we've seen special education in particular coming back. We do have a lot of special ed coordinators on the call. So we have a question about kind of moving back into the purple tier. How will that impact special ed that they have been meeting on campus, and what can we do to support LEAs to maintain that instruction if possible? If you could maybe speak to that a little bit.
Yeah, no, I'm really glad that got brought up, because we want to make sure everyone realizes that the cohort guidance is actually absolutely, is doable in the purple tier, and many schools were already doing this, like for example, for jurisdictions that never got out of purple. So, and we very much want, special needs children to be able to be working in those cohorts, and that's why we gave some very detailed guidance on that. But that's definitely allowable and possible in the purple tier. So we definitely, support that. Those are the priority groups to continue to meet the needs of your highest need students in those cohort sort of following that cohort guidance.
Michelle, I unfortunately have to drop off, but I'll just echo what Dr. Pond just said on that specific question, and also identify that as we think about those priority groups for cohorts and who should be almost the first to come back and maybe the last to go back to full distance learning, these are the kids, young people with special needs. I mean, I don't need to tell any of you as educators the difference that those assets and those tools at the youngest ages for kids with developmental needs or learning differences, how that makes an impact. So we want to make sure that that first cohort is those young people, so that they can benefit from what they need in person. And certainly density matters. The other piece of cohorts is density. Having a place that, and you said it, the break rooms to keep things spread out, become learning places unlike before. So doing that even with your cohorts makes a great deal of sense as another tool to keep them going, even as your county moves into purple. But that really, that wraparound support that we hope each of you finds from your local health departments and from the state as part of the tool to keep it going. With that, Michelle, I'm going to thank you again for having me. To all of you, thank you again for your leadership and your work, and I look forward to our next set of conversations.
Thank you, Dr. Galley. We really appreciate your time, and good luck with your press conference. So Dr. Pond, we'll continue the conversation with you if you have a few more minutes.
Sure.
Kind of continuing what Dr. Galley was just discussing in terms of the coordination with county public health officials. And we're getting a lot of questions related to that from LEAs. And in particular, when we're talking about making or furthering plans for in-person instruction, we're hearing from LEAs around the needs to support student mental health and well-being. And so it's almost like we've got a phase and approach where we're starting with the small cohorts, we're testing our protocols, and then we're starting to see the needs of students as they make that return to in-person instruction. Do you have any recommendations for LEAs and how they can coordinate with their county public health officials around some of the specific issues that we're hearing about related to student mental health and well-being?
Sure. I think many local health departments have sort of designated, a school's liaison. Of course, different health departments have a huge spectrum of size and what we say bandwidth, but many have developed, because, schools are so important, and there are a lot of unique issues and things to address around schools. So I would say reach out to the local health department, find out if there is a a specific schools liaison. You know, often I know certainly, again, just back to my own local experience in the Bay Area, we had both Office of Ed, you know, county-based meetings that were frequently. We actually had some regional ones too, where there were regional health officers and regional superintendents kind of talking and collaborating and trying to share, you know, ideas and issues and best practices. So I think certainly reaching out to the local health department, you know, again, often the local health officer is very involved depending on the local health department, or they have a schools liaison that can be kind of a point of contact. And again, as mentioned on the other side of that, I think it's nice for the health departments to know who is the kind of COVID lead for a specific district as well. And then another comment I just wanted to make sure I mentioned back to Purple and cohorts, and actually overlapping with special needs, is we wanted to make sure we highlight too how important equity is to us. Hopefully that's also really clear based on the fact that we put in a health equity metric around moving forward and reopening, and also the investment and funding that came from the state level that was allocated to schools. Over 80% of that 5.3 billion was allocated to special education, low income, foster youth, homeless youth, English learners. And so absolutely being able to prioritize those groups is really, you know, important, and we appreciate that. So I think, again, reaching out, and then, you know, many health departments, I think, have been able to try to have sort of routine periodic meetings with their schools just to kind of give an update on what's going on. You know, again, there's just always a lot happening with COVID-19, and I know it's helpful on the school side for them to be able to hear what's going on and just be able to share their kind of questions and concerns and issues to resolve.
So you did mention the equity measure. Do you have a couple minutes to maybe explain that a little bit? I know it's kind of a newer feature, but it's such an important one that we'd really like to learn more about.
Sure, yeah, I would be happy to. So and just briefly backing up for one other step, I mean, I think everyone sort of is very familiar now, but there's two kind of disease transmission main indicators that we're following as far as what color a county will fall into. So case rates and test positivity. And then the health equity metric is basically, the way it works is we've used something called the Healthy Places Index. And so this was an index that has been continued to be refined, that the Public Health Alliance of Southern California put together. And it is a compilation as far as the index of trying to look at different census tracts where people live and coming up with an index on how sort of healthy that place is, but based on not just your traditional, you know, medical health or even public health, but looking at the economic factors, the environmental factors, the built environment. There's like 10 different components that weigh into what the Healthy Places Index is. And it does overlap very well when we look at race data and race and ethnicity, and our Latin American and African American communities of color are largely, in most jurisdictions, largely focused in the Healthy Places Index that is in the lowest quartile of that jurisdiction. So we've taken each county and looked at if you look at the different quartiles of that Healthy Places Index and looked at whichever is the lowest quartile in which geographic region that is, and then looked at the test positivity as sort of a parallel marker or indicator of how much disease transmission is in that area. And we have said that in order to move forward, you know, from purple to red, for example, not only do your case rate and your test positivity need to be in sort of the red levels for at least 2 weeks, but you also have to make sure that your health equity quartile also meets the test positivity of the red metric for those 2 weeks. And then there's a way, it's as an incentive, we also built in an incentive for the health equity metric that if a county is in purple for their case rate, but their test positive, because that is what we're finding, and partially is we do have, again, kind of a pretty strict bar in what we're calling purple in California compared to some other places. And again, we think that is part of our success in being able to stave off these surges as long as we have. But if you're in purple for your case rate, and then you 2 levels down is orange, and if the county, for example, has an orange test positivity rate for the whole county, and in their health equity quartile, they have an orange test positivity, then they can be eligible for 2 weeks also, but then they can move into the red. So it was sort of another way to incentivize that. Again, it's on the other side of it, it's sort of, you know, we don't want to we don't want to sort of let a certain group be behind everyone else. They should be coming along. And I think obviously what also, is multiple purpose, and it makes perfect public health sense for so many reasons, because as we've seen, this pandemic has disproportionately impacted our essential workers and communities of color. So it really is where the most attention as far as testing and providing resources so that people, once they know that they are cases, that they can be safely isolated and not, lose wages, and safely quarantine anyone who's been in close contact with them. So really making sure there's an effort to prioritize resources there. And then we have an equity playbook for resources for health departments, and a lot of the COVID funding they got needs to demonstrate how they're focusing on that area and on equity.
Yeah, so we've actually been getting quite a few questions in the Q&A around potential resources, evolving guidance, updated guidance, and we've been trying to identify different resources that LEAs have access to. There's a lot of great material, but we are getting questions around the Department of Public Health and updating some pieces. I know with the school FAQs, the school guidance FAQs, they get updated. So I know some of our LEA partners are trying to get a handle on how they can access information, what's the best way. If you have any tips or recommendations around that in terms of, checking in periodically, we try to tweet and send things out as well, but anything that partners can do to help support Department of Public Health kind of get this updated information out. We've also been getting questions around related to some of the updates that you'll see in different spaces or different places, then going back to the industry guidance and wanting to know if there are any anticipated updates related to that maybe you can help clarify.
Sure. We have been, I'll just acknowledge that these things are in too many places. We're working on consolidating them all into one more easily, linkable one place to have most of this information. And we're actively working on updating this to have, again, a comprehensive update. So we keep thinking it's going to happen any day. And I think, this recent surge has sort of postponed this just a bit. But I do hope, in the very, I'm going to say hopefully even, I would love to make sure we can get this out by next week. And we're working on, again, consolidating and updating. So we will definitely make sure that we let CCEE know and sort of all of our education partners when we do update that. But we are actively working on some updates. And the other thing that I'm realizing maybe we didn't put on this slide, but there's also a testing playbook that we put together related to our regional lab, and really, again, prioritizing that resource so that we can provide that for schools that want or need it. So that will be something I think we'll make sure we post as well. So yeah, stay tuned, but we aim to update all that very soon, and working really diligently just to kind of give a preview, and we can talk about more of it another time too. But our contact tracing team, it's the IT thing is called CalConnect, but it's created this whole system that can be used statewide for local health departments to do contact tracing. And we have a special schools portal that we have just sort of created, and we've already used it with a few specific local jurisdictions and local schools, and some other really specific school resources related to once there are cases, being able to quickly work so that there's a lot of tools for schools and local health departments to specifically deal with any situations in schools, how to share data when that's happening, and also for jurisdictions that may need it, we're having these school-specific teams that could really, go to or help respond in a specific jurisdiction to any school situation.
Well, in speaking of the teams, it's interesting because of the participants that we have joining us today. We actually have a large number of school nurses, which we typically don't see at a CC webinar. So it's kind of exciting to have this group join us. And we've had some questions from the nurses in terms of kind of where can they go, maybe at the state level, to get some additional guidance. Obviously they're working with their local county public health officials, but any recommendations for the school nurses and kind of what types of resources they can access as well to strengthen the school team's approach?
I think it will be, the same as far as any of these guidances. And then as we develop these contact tracing teams, I mean, I think we do still really want And I would say, again, as a former local health person, I think we really do want the locals to be the main point of contact. Certainly we can be a resource, but we want to really provide technical assistance to locals as needed, and hope and help strengthen and provide resources so that both can work together collaboratively on the local level. So I would still, I think, refer them to their local health departments, but the resources on our state health department site, again, we will try to consolidate them soon. We're also in the process of about to revamp our whole website because we realize it's not as user friendly
Yes.
as it could be. So that's in the works as well. But we do hope it'll be an easy click, and that we can try to have links in CDE and other places as well.
Yes, absolutely. And it's interesting that you mentioned, as you're realizing all of this is coming together, revising the website, it's kind of an opportunity for reflection, even for you. If you maybe want to speak to kind of how you've seen things change over the last few weeks, even any kind of aha moments or lessons learned as we've kind of been going through this together. It seems like every week something emerges that's really complex and challenging. And I'm just curious kind of your thoughts on where you are in sitting with all of this. If you are open to sharing, we'd love to hear from you about that.
Sure. There's so much. I think it's been quite a journey for sure. I mean, I think, I think a few things. I think in watching, again, what has happened around the world and learning lessons, I think and I've said it once, but I'll say it again, I think I'm glad that when we developed our blueprint that we really wanted to be slow and stringent. And I do think that we managed to, over 8 weeks, actually, we were able to have a gradual reopening and start to allow things. I think the sort of frustrating thing is, I think because we are not an island, we're not we just have enough travel. Someone else earlier today was showing me a big map with just all the travel that's still happening. And so we couldn't, I think the way this virus continues to just, keep us on our toes and really can start to kind of really exponentially increase again, and quickly without notice, I think is a challenge. But again, I think I'm really proud of a state, how, as much as we can come together. I think the other thing I would say is that it is hard and certainly magnified. The good and bad about, our day and age with technology and social media is, on one hand, we're getting a lot of information out all the time, which is good, but I think there's also a lot of misinformation that gets out. And I think trying to stay on top of that from a public health and again, a pediatric infectious disease perspective, and really trying to help make sure people are getting good information and reliable information is a challenge. And actually, I guess the other insight I would say that is we're trying to figure out how to deal with this, and is hard, is I think, it's really great, I think, on this call. And of course it makes sense with educators that that you all have all these great questions and important questions about the science, but it's been really frustrating with this pandemic, how the science part has really been completely ignored or pushed aside by many. And I think that it has been why our country has not been able to deal with this pandemic in a way that we might have otherwise. Just the divisiveness around certain measures that are really clear from a science and public health perspective, but sort of they've become, some of them made us divide rather than come together. So I think that's just something that's been hard, I think, in seeing what we could be doing that seems really straightforward, and seeing some of those issues. But again, I think as a state, I'm really proud of where we have been and where we are, and I think we can pull together. And I think that's important to keep in mind related to schools as well. I think some of you have seen, a lot of European countries have really said, you know what, schools are our priority, our kids are our priority. And I really, I do feel we in the administration feel that way too. So we really need to be better about promulgating that message to all of you and to our entire community, because I think really, absolutely, again, I think our kids are our future, right? We need to be taking good care of them. So again, really appreciate all of the leaders on this call that are doing that every day.
Yeah. And, it really does bring us back to the science and the growing information we learn, like both of you said earlier, you know, it's almost on a weekly basis that we're learning something new. And so because of that and wanting to keep it grounded in the science moving forward, you know, we just wanted to remind the participants that, again, this is probably the first of a series of continued conversations. When we can have that opportunity to come back, always ground it, set the context in the science, setting the context in supporting our educators in equity, sharing out more information as it becomes more available. I've already received a number of messages from our statewide partners, Department of Education, county superintendents, that are more than willing and ready to help share updated guidance, linked to the new Department of Public Health webpage that will consolidate, probably curate a library of resources. We've also received a number of questions. Some participants joined a little late, so we are reminding people that this is recorded and that we can also share and distribute this along with the slides moving forward. We did have a special request. One of your responses specifically, someone wants to know, hear it again. So we want to let the participants know. Is there anything else that you want to share before we sign off? We've got a large number of questions. They're very detailed questions. I think a lot of them you've shared. You know, it's always important to start at the local level and then, you know, look to the state for some additional guidance and support. But anything else that you want to share that the administration is focused on kind of moving forward?
I think, you know, in addition to a lot of the resources, we're trying to make sure that we can help provide or help support, you know, everything from, you know, more personal protective equipment. You know, we've mentioned briefly the some of the testing sort of resources and the contact tracing resources. And I think actually one thing we talked about the cohorts in the purple tier, we didn't talk about the K through 6 waivers. So just to briefly highlight that
Yes.
again, you know, certainly again, if there were both for counties that are still in the purple tier that never left, or ones that have gone back, if there are schools that didn't reopen, and certainly again in this priority of the younger children, both because again they're lower risk and in all directions, and also probably benefit the most from in-person versus distance learning. There is that that ability to apply for a waiver to open in the purple tiers, and that we do feel like if all those you know, all these guidances are followed, that can be done safely if there's if people are, you know, doing it following all those parameters. And again, we've seen, it's interesting, I mean, on one extreme we've seen evidence in other countries or states of schools opening and then just sort of putting all that stuff aside and having large outbreaks. But there have been some somewhere in the middle too that seem to have higher levels of transmission and are not doing as many of these interventions that have not had huge, you know, hasn't driven their, you know, back to the point about not driving community transmission up and not necessarily having, you know, large outbreaks or things like that. So, so just making sure people are aware of that. I think
And
that
we are getting questions related to the waivers, so I'm glad you brought that up. But then also, you know, the plan kind of moving forward for the older grades as well. And so anything that you can share that might be on the horizon, kind of moving forward and supporting that. We are hearing from some of the larger school districts that have posted their reopening plans and they're moving forward with that. Any tips or advice, recommendations around that would be helpful as well.
I mean, I think what I've seen and heard a lot of is sort of a phased reopening. So whether it's starting from the younger kids first and, you know, gradually increasing, you know, a grade or a few grades of time, depending on the size of the school, that seems to be a successful model I've been hearing about and seeing that makes sense. And in general, I mean, that's sort of how we're approaching the whole framework, right? Community-wide is like phasing things in. So that makes a lot of sense and I support that. The other thing actually I should mention that we want to support, we just haven't formalized it, is outdoor. You know, the other fortunate thing, one of many fortunate things about California, but is, you know, weather. Yes, we have some rain and, you know, we are going into rainy season, but as much as people can do outdoors or we're going to allow for a waiver process for outdoor schools. I know there's some LA schools that are thinking about this, and we are just in the process of kind of formalizing that. But that is another way. So I think getting tents, and that's another resource we're looking at the state level too. So
Yes.
as much as can happen outdoors, especially again if there's eating involved and people are going to have their masks off, like even if there's indoor schools already happening, but then and then looking at models for doing a completely outdoor thing is something that will be allowed in the purple tier and that we think can be done relatively safely. So that's just an ongoing theme. As much as we can do outdoors is certainly safer, just the way this virus works.
And related to that, I mean, if gyms can do it, right, schools can do it. Put up the big tent and work outside.
Yeah.
We've had some questions also related to sports. That's kind of related as well. So anything that you have to share on that topic?
Yes. Yes, there's been a lot of great work looking at sports, and we will, I think, circle back to that as well. I will
Yeah.
say there's a draft sort of guidance that we worked on, and worked on. CIF had seen a version where we have tried to categorize sports into low contact, which can happen in the purple tier, medium contact, and high contact, and sort of figure out like how we think those should line up in the different tiers as far as purple, red, orange, yellow. I think, of course, at this point, we don't want to have any competitions, I think. And so we are, because that's more mixing, right? We've talked a lot about this mixing, and the idea of cohorts are really important. And so the more you add into that cohort, the more you might introduce the ways the virus could be crossing across different groups. So it should be forthcoming. I think the big questions we need to look at are, I think anything right now, of course, anything is allowed if like physical conditioning and practice that can be distanced with face coverings is allowed now. And then this will come out to say sort of other sports that can happen that is tier dependent. So we're circling back to see when we're going to actually release that. I think this surge again, we knew we were starting to have a slow increase, and then all of a sudden the surge happened, and we've been really focused on that.
Yeah.
I want to make sure when we do issue that, we are thinking long and hard about what we want to allow when, based on where we
Yeah.
the surge. But it's something should come out soon, and I hope it does provide some clarity for people. We of course absolutely value how important exercise is, and for both mental health and everything else. But we also want to again prioritize the learning.
Yep.
So I think that's another delicate balance we're all trying to do. But
Yeah.
yeah.
Yeah, we were getting quite a few questions around kind of extracurricular sport type activities and the relationship with mental health. And so it's really helpful that you provided that clarification. So thank you for that. With prioritizing learning, but also acknowledging and supporting educators and their students, and especially with the mental health and well-being needs moving forward. So quite a few topics that we can revisit in the future. We really appreciate your time. And unless there's anything else to add, I can just remind people that, again, thank you for taking the time. We had quite a few participants join us today, so we were really appreciative of that. And especially during the middle of the day, we have a lot of working educators, families, parents. We're all in it together, and we really do appreciate your time, Dr. Pon. We know you've been testifying and going to hearings and press conferences, and so the fact that you and Dr. Galley were able to join us today with the larger education community. We're just so appreciative of that. This is a group that we've been hoping that we could have some ongoing conversations. And again, we are looking forward to continuing to learn from you and support our educators moving forward. So thank you for that. And we can sign off. So thank you.
Great. Well, thank you very much for the opportunity, and I hope it does illustrate how important you all are as a community to us.